Hi friends, I am Dr. Meghna Krishnan, board certified diagnostic radiologist at Scottsdale, Arizona. Today I want to talk to you about an ultrasound exam that can be used in screening and diagnosing bone health in regard to knowing bone density, bone quality, and even predicting 5-year fracture risk. Traditionally we have used X-ray DEXA for this, but I'm so excited and thrilled that in this day and age of technology, we can do it with ultrasound too. It is called REMS Echolight. It is a radiation-free, software-assisted ultrasound scan of the lumbar spine and the hips for prevention, early diagnosis of osteopenia, osteoporosis, with short-interval bone health monitoring. The traditional X-ray based DEXA, has many limitations. Like it's very susceptible to positioning changes, it's operator dependent. Also, the results vary between DEXA machines based on the life of the cathode ray tube. So if the DEXA numbers could vary with such subtle changes, then the reproducibility is low and accuracy may also be of a concern. But in REMS Echolight, it has an automated internal quality checking software for every view. So that keeps accuracy and reproducibility high. Also, anecdotally, what we have seen is that the results are more consistent and reproducible between different facilities, which I think is pretty important if somebody is getting treatment for their bone health. The traditional DEXA imaging X-ray beam travels from back to front in the lumbar spine. So it gets topped by the denser posterior cortical bone before it can image the trabecular vertebral bodies in the front, which is where we need to check for bone density and quality. So that means that traditional X-ray DEXA may give somebody a false normal result, but all it did was look at the posterior elements. This is of concern, especially in patients with degenerative spine issues like bone spurs or those that have metallic hardware from surgery. But in REMS Echolight, we ultrasound the trabecular front part of the bone in the lumbar spine without going through the back posterior cortical bone. So that is more accurate. The built-in technology is also smart enough to cancel out the degenerative bone spurs and even metal, which is great even in the hips. So patients who have scoliosis or curved spine or patients who have a thin body habitus, they may also have errors with the traditional X-ray based DEXA exams. But in REMS, we can manually follow the curved spine so we can be more accurate with the results. The traditional DEXA typically detects changes in 1 to 2 years. So if someone needs monitoring to know whether their natural lifestyle exercise program or medication is helping their bone health or not, then they would need to wait 1 to 2 years for DEXA X-ray. But in REMS Echolight Ultrasound, we can see changes as early as 4 to 6 months, which I think is just wonderful for evaluating treatment response. This ultrasound works for anyone who is 21 years of age and older. So I think this is great because young people can start monitoring their bone health early in life so that they can be more proactive and make some lifestyle changes way early than to be told when they are elderly or postmenopausal, like in women, that they now have osteoporosis and they have a high fracture risk, which is very sad and difficult to treat at that time. So overall, I'm really very thrilled to be part of providing and serving you with this radiation-free, ultrasound-based bone density, bone quality technology. And I look forward to helping you and your loved ones be more proactive in enjoying excellent bone health. Me and my staff look forward to serving you at your appointment. Thank you and have a great day.